Hi guys, it's Miss Medic here, and today I will be doing a video on taking a red eye history. This is a common scenario to come across in ophthalmology OSCEs, and like any history you should check the presenting complaint, past medical history, family history, drug history and social history. In this particular scenario you have been asked to take a history from Jane, a 35-year-old woman with a painful red eye. So first of all, you would wash your hands and introduce yourself. You would ask the patient's name and date of birth. You should always begin with open questions. In this particular instance, tell me a bit more about this pain. You should follow the SOCRATES framework for pain, and this is a mnemonic. S is for sight, so ask Jane, is there pain in one or both eyes? O is for onset. When did Jane notice the pain in her eye? Did it come on gradually or suddenly? Was there any associated trauma? It is important to rule out trauma in ophthalmology. In most cases in real life, patients will willingly volunteer this information. But in the OSCE scenario, it is best to ask directly about trauma. C is for character. What does the pain feel like? In scleritis, the pain is like a dull ache. R is for radiation. Does the pain move anywhere else? In closed-angle glaucoma, a patient may have a headache. T is for timing. Is the pain there constantly or intermittently? If intermittently, how long does it last? E is for exasperating and relieving factors. Does anything make the pain better or worse? S is for severity. We typically talk about a 1 to 10 scale, 10 being the worst pain the patient has ever felt. There are also other questions outside pain that we should ask about. Is there any discharge? In conjunctivitis there may be clear discharge if it is viral, or purulent discharge in bacterial conjunctivitis. Have you noticed any change in your vision? If the patient has acute closure glaucoma or anterior uveitis, it is likely that they will have noticed changes in their vision. Have you been in contact with anyone else who has a red eye? This should be asked if you are considering conjunctivitis. Have you had a recent chest infection? Or ask about symptoms like cough. Upper respiratory tract infections are often associated with viral conjunctivitis. Does the patient wear contact lenses? This can be useful if you are considering bacterial keratinitis. It can also be useful to do a systemic inquiry. GI. Has the patient any problems with bowels? Inflammatory bowel disease can be linked to eye conditions. Has the patient any nausea or vomiting? This is often present in acute closure-angle glaucoma. Any urinary symptoms or recent treatment for STIs. Chlamydia can be a cause of bacterial conjunctivitis. It is useful to show empathy by asking the patient is there anything that they are particularly concerned about. In past medical history, you should first ask an open-ended question. Do you have any medical problems? Secondly, ask the patient a more direct question to screen for underlying conditions. Do you wear glasses? Do you have psoriatic arthritis or inflammatory bowel disease? Both these conditions are associated with anterior uveitis. Drug history. Has the patient any allergies? Are they on any medications? Family history. Does anyone in the family have eye problems? Social history. Ask about smoking, drinking and occupation. Thank the patient for divulging this information and summarise to your examiner. This concludes my video on red eye history taking. If you enjoyed it, please don't forget to hit the like button and subscribe for more medical videos.